weaponized disinformation, housing discrimination, harassment of women and impersonation fraud, voice cloning, deep fakes.
That was from a U.S. Senate committee taking testimony about some of the things that can go wrong when it comes to artificial intelligence.
But not all AI is concerning. Some of it is actually proven to be life-saving. And here's how it's already being used in healthcare right here in Central Florida.
Alexa, play my favorite song.
Your liked songs from Spotify.
Personal assistants, self-driving cars,
Dear guest, your meal is ready.
food-serving robots, and even more realistic robots.
My name is Sophia.
And you can't forget the chatbots like Google's Bard and OpenAI's ChatGPT, computer programs designed to have conversations with people using an artificial intelligence called deep learning. When asked about it online, WESH 2 viewers overwhelmingly had negative feelings about AI.
They're very powerful tools that can help us to be better, and sometimes if we are not educated on how to use those tools properly, then that's a concern.
UCF computer science professor Dr. Jonathan Mell.
I believe that we have a responsibility to continue to push forward as fast as we can to getting to these standards as an industry and saying, here's how we make them the right way. Because, frankly, if we don't make them right, someone else will make them wrong.
The bottom line, artificial intelligence isn't going anywhere. It's already all around us. And at times, even inside us.
Beautiful job. Okay.
This is video of a colonoscopy being done by gastroenterologists at Orlando Health. And the scope being used uses AI.
The AI is able to detect polyps before you even see them.
Which is a pretty big deal because Dr. Anil Singh says polyp detection is the cornerstone for colon cancer prevention. Now here's how the technology works. As the doctor navigates a patient's colon, the AI will create a green outline like this to suggest a possible area of concern that may have otherwise flown under the radar. It's kind of like having a bunch of extra, highly trained eyes looking out specifically for polyps that need to be removed.
Generally, they are pretty accurate.
AI is also helping radiologists at Orlando Health.
It's really me as the radiologist interpreting the study, but the AI is baked into the image already because we have this beautiful, crisp image.
Dr. Jonathan Kazam is the director of radiology at the Orlando Health Jewett Orthopedic Institute.
In radiology, we like to have kind of very sharp-looking images because then it makes our ability to interpret the scan a lot better. The machines are now able to do, the same things they were doing before, but faster and better.
He says the tech even makes the physical machine more comfortable.
It's going to be a wider opening. It's not going to be as tight. You're going to be in and out of there in 5 or 10 minutes as opposed to 45 minutes.
About 4 hours ago.
Meanwhile, on the patient care side of things, local company Care AI is using AI to create smart hospitals and smart care facilities, like nursing homes. Chakri Toletti is the founder and CEO.
As it is, there's a significant crisis on our hands when it comes to nursing shortage, right? Technology is the only way that you can help the bedside care teams to really scale.
His company's ambient monitoring system monitors patients, their rooms, hallways, and public spaces to predict problems before they escalate. One example, it tracks patient movement and can detect when a patient is about to fall and alert staff, which is huge for nursing homes. Or it can scan and check guests in. Or simply foster accountability by keeping track of how often hands are being washed, surfaces cleaned, meds and food given.
Using AI to help them be more efficient is going to be the future, and technologies like ours will help the clinicians to be more effective and efficient and deliver the best world-class care.
Summer Knowles, WESH 2 News.